H. pylori. So H. pylori is a gram-negative organism, and it is well known for its ability to cause peptic ulcer disease and also gastric malignancies. So that is H. pylori. And then the thing about how it acts or how it gets into the system, maybe through a fecal oral route, so family history, low socioeconomic status. These are the ways by which you will see its predominance. So in addition to that, now if I were to come on to the way how it makes itself in its habitat, which is the stomach. So the stomach is known to have a very low pH, and this does not necessarily favor the growth of pathogenic organisms. So what this organism has to do is it has to find a way to evade that, meaning it has to find a way to increase the pH, and it does so by an enzyme known as urease, which breaks down urea to ammonia, and that ultimately increases the pH. So now it is able to survive the pH, but being known to reside in the mucosa, meaning the upper layer, what it has to do is it has to somewhat get into the mucosa. So the way I used to remember is by using a mucolytic, right? So the mucosa, the intestinal cells producing mucus, so it has to have a mucolytic that enables it to get to its habitat. So it has urease to alter the pH, so it has a mucolytic to get into that area. So now it is in that area, and it is known to generally damage the surrounding structures through a cytotoxin production. So it's now inside, and it is producing dangerous cytotoxic agents. Now, in addition to that, it is also known to increase the pH. So it's got a variety of stuff. So this is how it works its way, and brings about these things, right? So it causes malignancies, it causes the peptic ulcer disease, which is the well-known one. And then how are you going to identify it? If you're going to identify this one, the way to do it would be, you can do a breath test, but the well-known way to confirm this is through an endoscopic biopsy. And nowadays that is done under, if sometimes it's preferred under general anesthesia, or it could be an outpatient procedure. But general anesthesia is said to reduce some of the complications. Okay. Now, having said that, how am I going to manage this? So I'm trying to keep it as simple as possible. So managing would be something known as triple and quadruple therapy. So what this basically means is, I'm not going to go into the agents, I'm not going to go into the details, I'm just talking about the concepts. So the agent, so there'll be something like a baseline perhaps a proton pump inhibitor. This could be something like omeprazole, something like that. So in addition to that, you're going to overlay that with 2 antibiotics. That's your triple therapy. And you overlay that triple therapy with a mucoprotective agent like bismuth sulfate, and there is your quadruple therapy. So that's basically it, because this antibiotic therapy is known to have a very good success rate. So early identification,